Hello, welcome to my presentation of the diagnosis of skeletal diseases using CT and MRI fusion. So skeletal diseases encompass a wide range of conditions that affect the bones, joints, muscles, and tendons. And it can manifest in various forms, including the osteoporosis, bone tumors, and the musculoskeletal pain syndromes. The traditional methods such as X-ray often lack the precision necessary for early detection and tracking diseases. And this presentation will divide into biological basis of skeletal diseases, primarily on bone metastasis or neoplasms, the physiological changes associated with it, and how CT and MRI fusion imaging modality can be utilized to enhance the diagnosis and tracking. So bone metastasis can be categorized into primary or secondary based on the origins. Secondary skeletal metastasis are often seen where the tumor occurring from the other organs that have a unique inclination for spreading to skeletal system. For up to 65 to 75% of breast and prostate cancer patients, bone metastases are detected at the same time. So breaking away from the primary tumor and invade into nearby tissues, the cancer cell into the blood vessel or lymphatic channels that lining the blood vessel in the bones. Adhesion molecules in both cancer and the endothelial cells plays a vital role in this process. Once inside the bones, cancer cells disrupt the balance between the bone formation and the bone resorptions. These factors that simulate the osteoclast activity, leading to the bone breakdown. And this is the diagram showing the steps of bone metastasis development. And it comes to the traditional imaging modalities. For most of the circumstances, the tumor itself is not highly visible and cannot be dissected by the radiography without leading to bone degeneration. In addition, the early stage of minor bone matrix lesion can be easily missed or mixed up with the osteoporosis. CT is one of the routine image modalities when the skeletal disease is suspect. It performs well on detecting the bone matrix destruction, resorption, minor fractures, and the calcification led by the metastasis. As mentioned, one of the syndrome by tumor invading the bone is osteolysis, which leads to destruction of the bone tissue matrix, hence reduce its density. In the CT scanning, it will appear darker than the normal bones. In comparison to the CT, which detects the abnormalities in the bone structures caused by the metastasis, MRI is better in terms of detecting soft tissue differentiations, such as bone marrow involvement and the other alternations of composition. With the some advanced functional MRI variations, such as DWI, diffusion-weighted imaging, which evaluates the cellular level water molecule movement. The lesion in the bone marrow can be quantitatively observed. Computed CT generates the contrast in the image based on the different attenuation of radiation when penetrating through the different tissue. Since the X-ray tubes are rotating around the patient while the patient is moving orthogonally to the X-ray array, CT is able to collect the information by slices. Well, with concerning the restriction of CT, MRI is excellent at differentiating between the different types of soft tissue based on their unique magnetic properties, such as the recovery rate or desynchronizing rate of hydrogen nuclei in the tissue. This ability to provide excellent soft tissue contrast without using the ionization radiation. However, with concerning the restriction of each imaging modality, CT imaging tends to lose detail on soft tissue such as bone marrow, while MRI cannot depict minor lesions in the bone structure. The fusion of the two modalities, which is MIF, multimodal image fusion, has become the key to resolving the problem of limited information acquisition from the single imaging modality. By taking the images at the same position and generate a single image through reconstruction, the steps of image fusion involve the alignment, registration, and the reconstruction. As the figure shows, image restoration is a fundamental step in the multimodal imaging fusion. It involves aligning the CT and MRI images, especially into the same coordinate system. Different restoration techniques such as rigid, affine, or non-rigid transformations are used to ensure that corresponding anatomical structures match accurately. And the image fusion method can be categorized into intensity-based, feature-based, and the transform-based fusion. By involving the convolutional neural networks or other AI-assist technology, the different fusion methods can be proceed at the same time. The intensity-based fusion refers to combining pixel or voxel value from the corresponding locations in CT and MRI images, where pixel values averaging is involved. However, it combines the image based only on the pixel or voxel intensities. This approach can lead to loss of valuable information, especially when the relationship between the intensity in CT and the MRI is complex and nonlinear. While feature-based fusion involves extracting the specific features or characteristics from both CT and MRI fusion, these features can include edges, textures, or image attributes. Algorithms then combine these features to create a fused image that retains the relevant information from both modalities. And transform-based method involves the transforming one modality's image to match to other modality's character. And here is an example of success. As a paper suggested by Dr. Du, there's a case of bone metastasis or suspect of a 13-year-old patient. 3 imaging modalities, X-ray, CT, and MRI, were applied individually around the site of interest, where CT successfully revealed the bone lesion, and the MRI created a mixed signal on the huge mass in the soft tissue. But later, using the CT and MRI fusion techniques, it reveals the actual size of the tumor, and it discovered some emboli in blood vessels. which comes to the decision of amputation was made.